the pain was regularly between 0 and 2, from 0 to 10, which was something that the patient never had since the surgery. Hi, today I'm talking about a set of two very important Master Tung points. These are 7701 and 7702. Their names can be translated to upright tendon and upright ancestor. During this video I'll show you the location of the points, how to puncture them, and stay until the end of the video because I'll share with you a clinical case where I use these points so you can see how to combine them with other points for more complex cases. If you like the techniques that I talk about in my videos, check out the links below where you can see all the courses I have available. I have courses in Portuguese and in English, so check them out and start learning today. These points are amazing for neck pain, especially if the patient has a really stiff neck, like one of those where the patient comes to your office like this and has to turn himself like Robocop because he can't turn his head. That's when you must think about these points. But I know that a lot of professionals choose not to use these points because they're scared of needling them. And the reason is these points are right on top of the tendon. So they are on the Achilles tendon and you must go through the tendon and touch the tibia if you want to get the full effect. And for what we learn in most acupuncture schools is you must not go through the tendons. So this can be daunting for an acupuncturist, and that's why a lot of acupuncturists miss out on these points, which are an amazing resource for you to have. And why are these points so amazing for neck pain? Well, as we see on most Master Tung points which have these extraordinary results, they work so well because of a combination of factors. So if you want to do just the most superficial analysis possible on these points, let's just look at their location. As you can see here in the image, the points are located over the Achilles heel on what would be more or less the bladder channel, and they're close to the ankle. So 7701 is aligned with kidney 3, so right at the height of the ankle, and 7702 is located soon above. So if you think about the images, if you represent the head on the foot, the area of the ankle will represent the area of the neck. Therefore, the image is perfect to treat this area. If we go a bit deeper and we think about the channels, what's the most commonly affected channel for a stiff neck? This is the bladder channel. And these points are on the bladder channel, so you can think of them as guiding needles to treat the bladder because the channels also treat themselves. Another very important action that we can have over stiff necks: what is the most common cause for stiff neck according to TCM? It's an attack by wind or cold wind, right? So where are these points located? They are over the tendon. We know that tendons and liver have a very strong connection. We also know that the liver and wind problems have a very strong connection. So if you're puncturing a tendon, you're acting on the liver and you're acting on wind. So if we sum everything that we have already, we have a perfect image to represent the neck. We have a channel that passes over the affected area, which is the bladder, and we have a structure that connects to the liver and therefore connects to treating wind. So we have location, channel, and the agent responsible for the problem. All of them are being addressed, and this is even without going inside Master Tung's theory. But just with this, you can see that the points are amazing for this effect. But now let's go a bit deeper into the theory and think about Master Tung. And when we think about Master Tung, we must think about the Zheng Jin of the point, or the Master Tung channel that is allocated to these points. And in the case of 7701 and 7702, they both have the Zheng Jin of the spine. So we were already addressing all the soft tissue around the neck according to TCM theory and also to the balance method, right? Image, channel, and the tissue where the needle is placed. But now we also have the Zheng Jin saying that we are also treating the bone. Plus, as I told you, when you go through the channel, you're aiming to touch the tibia with the tip of your needle. So you're actually using bone to treat bone. So you're touching the bone of the tibia to treat the bone on the spine. So these points can be used to treat any kind of neck pain because they treat every kind of potential problem around the neck. And now, so that you can be confident enough to use these points, I'm going to show you how we can puncture them in a very safe and very painless way. So, as you can see here, I placed the patient belly down. This can also be done sitting down, but it's harder to do. So if it's your first time using this point, I'll advise using this position, and you place the patient with the foot outside of the treatment table. You will straighten their foot, locate the point and locate the tendon, and insert the needle right in the middle of the tendon. For this, I advise that you use a needle that's not too thin. In the video, I'm using a 0.25 through 60 needle, and I advise you to use the guiding tube. I'm usually against guiding tubes, but in this case, I think it can be very helpful. And now the most important thing is, as soon as you puncture the tendon, you must keep the needle moving. If you stop with the needle in the middle of the tendon, it will be very painful for the patient. You will feel some resistance from the tendon, but you just need to apply constant and uniform pressure. We don't want the needle jumping inside. We want a constant pressure and just slide the needle through. As soon as you go through the tendon, you will feel the needle release, so no longer you're forcing it against the tendon, and then you can take a deep breath and slowly push it until you feel it lightly touching the bone. After that, you ask the patient just not to move his foot, or else it will be uncomfortable, but this will be perfectly safe and perfectly painless for the patient. And now I will talk about a clinical case that I had a few years ago, where I used these points. So you can see how you can combine these points with other points in a treatment. So this was a 53-year-old female patient, and this patient had had a car crash 2 years prior to our appointment, where she suffered whiplash. So her neck was always painful. She actually had some spinal damage, and she had to do a surgery. She had some metal plates along her spine, but she was constantly in a state of pain. From her neck, she had lost some function on her arm. She always had the feeling of a stiff neck where she couldn't turn her head properly, and this was all on her right side. So as soon as I saw this, I said this is a perfect case to use 7701 and 7702, because it's a serious problem with the neck. You have stiff neck, but you also have bone problems, so these points will be perfect. But I combined them in a global treatment. And what did I do? So the first thing I did, and the first thing I always do when treating the spine, is using the mais to treat itself. So I looked for Ashe points close to do 24. After this, I went for the points on the body, and the points that I used were on the patient's opposite side. So if the pain is on the right, I started on her left side using small intestine 3. Why small intestine 3? Because it balances the bladder. If we think about the image, it's on the head, so her pain started on the head and went all the way down through her neck. And plus small intestine 3 opens the mais, which I also knew was important to treat her actual spine. On the opposite side, I used points of the lung and around lung 9. So I palpated for acupoints around lung 9. Why? The lung balances the bladder, which was the main affected channel, and around lung 9 because the area of the wrist can represent the area of the neck. Then we go to her feet, and on the side of the pain I used 7701 and 7702 for all the reasons that we already discussed. And on the opposite side I searched for acupoints between kidney 3 and kidney 7. We know that the kidney balances the bladder, and we know that this area will treat the area of the neck. The results were immediate. This was a case where the patient was very uncomfortable with the idea of the needles, so I was almost reluctant to use 7701 and 7702, but the patient agreed to it. It was painless, and as soon as I placed these needles, the patient registered that she could move the neck better and that her pain was way down. She described her regular pain not being in crisis as between 5 and 6 to 10, and after the needles the pain went down to 2. I saw the patient 2 times a week for 1 month, and after 1 month the pain was regularly between 0 and 2, from 0 to 10, which was something that the patient never had since the surgery. Of course, in a case like this, it's very hard to stop the treatment, so we kept doing 1 session a month just to keep the pain low until the beginning of COVID. Unfortunately, with COVID, we had to close the clinic and we stopped the treatments, and I haven't heard from the patient since she stopped the treatment, but for a period of around 2 years, we could control the pain with just 1 session a month using more or less this treatment. Of course, as I told you, we were using acupoints, so the treatment would slightly change from session to session, but this was the idea behind the treatment. As you can see, these points are very powerful. This was a very complicated case, so I had to combine them with other points, but for most cases of stiff neck, these points are enough. The patient arrives, his head can turn, you place 7701, 7702, and the head starts moving back again. So please don't be scared to use these points, but also if you've never had in-person training in Master Tung acupuncture, if no one ever showed you how to puncture these points, you should look for a competent and experienced teacher that can show you in person. But these points are nothing to be scared of. If you are a good acupuncturist, you can use these points with safety and without any pain for your patient. Thank you so much for watching. If you like this video, don't forget to like, subscribe and share it with your friends, and I'll see you in the next one.